Starting this topic on green dialysis unit. So, we start with the case first, the hidden cost. So, 45-year-old chronic kidney disease patient on hemodialysis is undergoing hemodialysis since the last 3 years. He lives 40 kilometers away and has to travel 3 times a week to this dialysis unit. One dialysis session, as such, utilizes 150 liters of water per session. And that amount of waste per session created by one patient is up to 1 to 2 kilograms of plastic waste. And the amount of emissions, that is your carbon which is released while transporting yourself, the patient to come from his home 40 kilometers away to the center, is the additional thing. So dialysis saves life, but question is, are we healing the patient and alongside harming the planet? So what does statistics say? Healthcare contributes to 5% of global emissions. So a session of dialysis is utilizing 120 to 500 liters of water, 400 to 500 kilograms of carbon dioxide per patient per year is being released, and around a ton plastic waste is generated by one patient per year. So you know how many number of patients are undergoing dialysis in this world and what will be the wastage and the pollution created by this particular dialysis. So among the highest footprint therapies in medicine, and that is why in 2026, the World Kidney Day theme was Kidney Health for All, caring for the people and protecting the planet. Before going into understanding what exactly these words mean, so looking at the first point, that is carbon footprint. So the total green gas houses produced by activity or a person or system which is expressed as kgs or tons of carbon dioxide equivalent is called as a carbon footprint. So carbon emission means actual release of that green gas houses into the atmosphere. And the main sources of this comes from burning fossil fuels like electricity, transport, through industry like cement, steel, healthcare like dialysis, ICUs, surgeries, agriculture. So it is coming from all around us. A carbon footprint therefore means the activity and into the emission factor. To understand this, some few examples from daily life. 1 kg kilowatt of electricity is around 0.7 kg of carbon dioxide in India. When you use 1 liter of diesel, when you burn 1 liter of diesel, it is around 2.6 kgs of carbon dioxide. And one hemodialysis session, just one hemodialysis session produces 3 to 10 kg of carbon dioxide emission. If I had to give it in the form of an example of the patient which we mentioned, so one session is 5 kg carbon dioxide. So 3 sessions per week will be equivalent to 156 sessions a year. You have multiplied 12 into the number of years, and annual footprint will be multiplying 156 sessions that the person will undergo in a year into the 5 kg per session. That means he is producing around 780 kilograms of carbon dioxide per year, which is equal to 0.8 tons. And when you compare this with a daily life, like driving a petrol car of 1 kilometer is equal to 0.2 kilograms of carbon dioxide. So if a dialysis yearly footprint will be around 780 kgs divided by 0.2, that is driving a car up to 4,000 kilometers per year is one dialysis patient generating carbon emission. So that is the amount of pollution and waste we generate while doing one session of dialysis. So what is the importance of this? The temperature is on a rise. Global temperature increased by 1.1 to 1.2 degrees since the pre-industrial era. The sea level is rising by 20 centimeters in the last century, and we are feeling the extreme heat waves, floods, cyclones, ice melting in the Arctic and the glaciers shrinking. So carbon emissions basically lead to high greenhouse gases, and that has caused to what we've now facing global warming. This particular few months of summer in Kerala was around 40 degrees to 42 degrees, and we faced the maximum summer this year, all secondary to the green gas houses effect and the global warming. As per the Indian perspective, we have a very high CKD burden. We definitely have water scarcity regions, and the rural travel burden is very high. Patients have to travel long areas to reach to the dialysis unit. So therefore, sustainability is a necessity. We need a program by which we can balance it out. We are not saying that we cannot dialyze a patient because it is generating carbon emission. We are trying to see how, as a health worker in a dialysis unit, can we bring down this particular carbon emission by doing some simple things. That is what we are going to look into. Before that, we should understand that environment and kidney as an association. What is the association between direct association? That is one of the reasons for chronic kidney disease in India is heat stress nephropathy. Because of recurrent dehydration, hyperosmolarity, because of high uric acid in the blood and rhabdomyolysis, because of the heat what is generated outside, the temperature causing chronic tubular interstitial disease, and finally the patient ending up with chronic kidney disease. Usually it is a young male laborer, farmer, patients, people working in brick bins or very heat areas, fatigue, cramps, and heat intolerance. They may produce some protein in urine, subnephrotic range protein in urine. And when you do a biopsy of the kidney, we see that they have got chronic tubular interstitial disease. Basically, they need hydration, rest, and CKD management. The other environmental factors which Kerala already had faced once was a disaster like floods. Because of floods, there are infections, and infections led to the tropical diseases and AKI burden. So when you look at the environmental factor like heat, the mechanism is dehydration, vasopressin activation, and when you look at air pollution, it is mainly the fine particulate matters released from the gases of the vehicles and the inflammation and oxidative stress which it creates in the body. Metals like lead, cadmium, arsenic, heavy metals, they cause direct tubular cell toxicity. And the polyfluoroalkyl substances, what we call as PFAS, they cause mitochondrial damage and mutations. And the agrochemicals, which come from the agriculture, they cause tubular necrosis and interstitial fibrosis. So that directly causes kidney damage. So the environmental threats like global warming, floods, fine particulate matter pollution, which we face a lot because of the pollution generated from the industries, have to be prevented. As far as CKD burden is concerned, we know that diabetes and hypertension are the leading cause of chronic kidney disease. And you have to tell your friends, your relatives, and the people around you and yourself should look into these modifiable lifestyle factors. Decreasing the burden of smoking, unhealthy habits, alcohol use, obesity, exposure to nephrotoxins, increasing the physical activity and exposure to heat, pollution, and agrochemicals. And to prevent the other diabetes and hypertension early, we need to know the timely diagnosis and adequate treatment. And we all are aware that to prevent the chronicity of chronic kidney disease and coming up from diabetes and hypertension, we need to do a basic test of creatinine and urine routine to identify whether there is loss of protein in urine, which we call albuminuria, which is the earliest detection and the earliest step in the process of increasing or decreasing renal function. And we now know that we have got newer treatments for these in the terms of the four pillars for the retardation of progression of diabetes, like ARBs. The name of the drugs are telmisartan, losartan, which you have heard every time when you write the dialysis books of the patients. But this is at the step before dialysis. We are talking about prevention at the stage of chronic kidney disease and the progression of chronic kidney disease. And newer drugs which have come, the GLP-1s and the SGLT2 inhibitors like dapagliflozin, empagliflozin. So your relatives, your friends, your people, you yourself should take care of yourself. Check your creatinine and albumin intermittently whenever you're having any risk factors, and look into the onset as well as try to retard the progression of diabetes. But when you look at the 8 golden rules which we mentioned before, which everybody have to promote in our society about the regular physical activity, healthy diet, hydration, glucose control, blood pressure control, avoiding smoking, and regular kidney function testing is very, very important. Because when you have an intensive CKD management, to delay dialysis by even 6 months, if you can delay the dialysis of a patient, you are roughly preventing 78 dialyzers, and that sessions will be equal to 12,000 liters of water per patient you can save. And that is why each one, if you take one step like this to save a patient from going into progression, you are indirectly trying to save so much of the burden of environment because of the disease. And there are a lot of evidence to mention that when you treat the patient on time, you can save cardiovascular events by 12% and dialysis and transplant by 21%. But what, as a dialysis technician, and what, as a part of dialysis unit, can you do to impact the outcome? That is where we are looking at, and which are the areas which we should be concentrating. So the concentrating areas would be the water, the RO systems, the energy use, the wastage which we generate, the plastic waste, and the transportation of the patient. These are the common 4 areas where we need more attention. Now, what are the steps towards this green dialysis unit? So for that, we start with the first green prescription. So whenever you are trying to give a dialysis prescription, what can be done best to prevent the amount of carbon emission? If a patient is stable and is meeting clearance targets, so your patient is doing well, the urea clearance is good, your urea reduction ratio KT by V is all perfect, patient is fine, you can consider to reduce your dialysate flow from 500 ml per minute to 400 ml per minute. You are trying to just conserve 100 ml per minute in this particular step, and this can save up to 25% of the water and energy per treatment without compromising the clinical outcomes. This is a very simple step which you can do. Patients whose urea, creatinine, and the values, biochemical values are fine, patient who is maintaining the dry weight, patient who is having no other clinical factors showing signs of uremia, and patient is maintaining a good blood pressure. In these patients, you can consider to reduce the dialysate flow rate, which is easy step just to reschedule it to 400 ml per minute, saving around 25% of water and energy. Second thing is about incremental dialysis. Not all patients require 3 per week dialysis. Not all patients even require 2 per week dialysis in the beginning. So for patients with significant residual renal function, what do you mean by residual renal function is patient is having a good urine output and patient is being dialyzed because of biochemical parameters or because he has a cardiac problem, considering starting with twice weekly sessions rather than starting with the standard 3 times per week sessions can be considered. So you can save one session in such a patient, significantly reduces unit's total carbon footprints and preserves the patient's remaining kidney function even longer. So it is important to find out whether the patient needs the number of dialysis session and adjust it as per the urea reduction and the KTVY values, and manage the patient on 2 per week dialysis if he is maintaining good dry weight, maintaining good blood pressure, and he is healthy. Now, when you look at the second step, that is about the radical waste segregation. So the patient's dry waste audit. This is a very simple and easy thing which you can do in your unit. You have to ensure that non-contaminated items. What I mean by non-contaminated items is the packaging, the clean cardboard, the plastic wrap around the dialyzers. They go into the recycling bins, not the yellow or the red bags. By chance, certain times in a hurry, patients, the technicians or the people working in the unit, hurry burry, maybe the cleaners in the unit, they may put wrong items in wrong bins. So if you put a packaging, clean cardboard or a plastic wrap or dialyzer in the yellow bin, the problem is when you dispose this clean plastic as clinical waste, it will be the incineration of this is done with extra amount of energy, extra amount of electricity. So it will take almost 20 times more expensive and much more carbon intensive when you do a simple mistake like wrapping it in the wrong bin. Purge the lines thoroughly. Purge the lines thoroughly means before disposing of the blood lines, you ensure that you're fully drained of the fluid. So sometimes the dialyzer will be having some fluid inside and you're not fully flushed it out and you put it in the waste bag. Now, when it goes for incineration, your amount of incineration is set based on the weight of the waste. So when the water is inside the dialyzer, the weight of the dialyzer will be more than the one which is purged completely and dry. So it is important that you purge the lines, purge the IV lines, all the thing without any water inside or any left out. When you dispose it like that, the fully drained fluid, then this reduces the weight of the waste, which directly lowers the energy required for incineration or disposal. These two steps, that's the dry waste audit and the purging the lines thoroughly, can be done very easily from tomorrow itself. Now, next comes is conserve water and power. Now, when you talk about conserving water and power, it is a zero flow during setup. So mainly sometimes the patient is not started and not hooked onto the machine, but the dialysate flow is started off and is moving. So you ensure that the dialysis flow is turned off or set to the minimum while the machine is waiting for the patient to be hooked up or be started. So that is about zero flow during setup. And second thing is about the conserving of water, that is your RO reject water. When you reuse reject water, the clean water filtered out by the reverse osmosis system and used for unit toilets, cleaning floors, or watering hospital gardens. So you can just connect the pipe to the reject water and take it out, and maybe you can use it for your hospital gardens. You can reconnect it to your unit toilets, or you can use for using cleaning the floors as well. You don't need to waste that water. Next is about solar powered systems. So all the place there are certain units in Cochin where they are trying to incorporate solar power for running the dialysis unit or maintaining the area around the dialysis unit for the light and electricity, which will help us in reducing the amount of electricity used and the amount of carbon emission generated producing this electricity. Next part is about the sorbent dialysis cartridge in conserved water. So what is basically in conserving water, there's a new technology coming up. It's using a sorbent cartridge dialysis. It is a technology that uses a multi-layered chemical cartridge to continuously purify and regenerate spent dialysate, which is allowing for the treatment with as little as 6 liters of tap water. So where you are using 150, 200 liters of water per patient, here you will be using as low as 6 liters of tap water. This new technology has a cost barrier for sure, and some side effects in the form of aluminum toxicity, and some places it was seen that there was an ammonium breakthrough. So more research is going on this. But you must know about this dialysate system because that is definitely going to be there in the future. So basically, the blood comes from the patient, goes to our normal routine dialyzer, and is sent back to the patient. The spent dialysate now passes through this sorbent cartridge. The sorbent cartridge contains zirconium oxide and zirconium carbonate, zirconium phosphate, urease, and activated charcoal. So the spent dialysis, as it moves from activated charcoal to the zirconium oxide zone, the particles, the waste, everything of the water is re-cleared, and it almost becomes as good as a pure water. And to this pure water, they add in the electrolyte concentrate of potassium, calcium, magnesium, and the dialysis fluid solution is ready to recirculate back to the dialysis. So this is a method by which you can conserve water as much as 100 liters per patient. Next practice is about digital and lean practice. So what you're trying to do here is the medicines are manufactured in the factories. The number of medicines more manufactured, more will be the number of workers, energy, and the consumption and release of greenhouse gases. So by decreasing the unnecessary pill burden in a single patient at your dialysis unit, you are trying to reduce the need for number of medicines and also the production of medicines. So this is how you have to review the patient medications to stop any unnecessary supplement of drugs is going on. Every pill has a manufacturing and a transport carbon cost. So the basic idea is an indirect way of reducing the carbon emission. The less the medicines utilized by proper utilizing and checking the medication sheet, helping us to reduce the pill burden, eventually leading to decreasing the manufacturing and transport carbon cost. Now going to paperless, that is switching to digital charting and electronic lab results. Now we have almost acquired it in most of the hospitals. We are going digital. We have got NABH coming up in hospitals. So many of the paperwork has definitely gone down. So less the paper required, less is the waste management, less is the carbon emission. That is the main idea behind going paperless. Next thing is very, very important. That is about telehealth triage. For a stable patient who needs to show the monthly report to you to find out about the calcium, phosphorus, uric acid, hemoglobin, and whether the dialysis is adequate, to check on to the medications, there are two ways to go about it. When you find that as a dialysis technician in your unit, if you find the patient is extremely and possibly very stable, he's got no other symptoms, and on rounds the doctor has already seen the patient. Now the report comes on the other day, on the regular monthly report day, and the patient needs to see a doctor. It can be done that you can do a telehealth triage. You can identify those patients which can be managed on consultation through audio, video from home. And this video consultation will replace the physical trip to the clinic or the hospital. The amount of time, amount of kilometers spent, and the carbon emission generated by the transport for seeing this patient can be reduced. And that is where this telehealth triage really helps in decreasing carbon emissions. So digital and lean practice depends on the decreasing the pill burden, going paperless, and telehealth triage. This is another very important thing which all the dialysis heads who are listening, or a dialysis chief who are listening to this particular, or even the dialysis technicians who are listening, you should tomorrow go to your units and identify a sustainability or a green champion. What do you mean by a green champion is they are being given one task to do in the number of tasks which we mentioned in the list before. If you suppose you'd see whether the disposal or waste is in correct bins, that is all the task is. So for that whole week, the green champion will go and check the yellow bin, the red bin, and the waste basket to identify that whether there is a wrong putting of the particular garbage in the wrong bin, and identifying this and correcting it. This is the task. So that particular week or that particular month, one of the team member will be the green champion. So identifying one nurse, one technician who are interested and meet for 5 minutes tomorrow to pick one green goal for the week. You can just perform this and make a register in your particular dialysis unit. You name the register as Green Dialysis Unit Register, and you write the goal 1, to check whether suppose the dialysate flow is 400, how many people achieved. Goal number 2, how much waste was disposed in the proper or not proper. If it is proper, just mention the date and write proper disposal, proper disposal. So this gives a additional register maintenance, which will help you in NABH and other factors to show your responsibility towards your planet and your environment, which means a lot. This is going to be a part and parcel of the curriculum in the coming years. It is looked upon in a very seriously and a big way. Educate your patients. Briefly mention to your patient that the unit is trying to reduce the waste. You have to educate them about that. Educate them about the water intake so that they don't come in fluid overloads, and that amount of extra dialysis which is done can be avoided, and that much carbon emission can be avoided. You can educate certain patients who are fit for transplant, or you think they can consider transplant, to give them the option of transplant so that they can discuss this with their people at home and can go ahead with that. So basically, when you talk about a green dialysis unit, you're talking about reusing RO reject water. You're trying to look into solar powered systems. You're trying to waste segregate. You're optimizing the dialysis flows. You're trying to shift the patient, whichever possible, onto home dialysis or peritoneal dialysis. To speak about this difference of controversy between HD versus PD, HD, definitely the usage of water is very, very high, but the wastage is moderate as compared to peritoneal dialysis, which has got low water intake but high plastic wastage. But overall, in the long run, peritoneal dialysis will be much greener compared to the hemodialysis. And educating about peritoneal dialysis to the patient is important wherever feasible. Whichever patient can consider it should be considered. As we know, there are certain populations like patients who are having cardiac issues, heart failures, where peritoneal dialysis is far superior than hemodialysis in elderly population, can be considered if the things are feasible for PD. Single use versus reuse dialyzer. Let's look at the left side of the slide. For reducing volume, you can strip packaging outside the treatment area so that you can divert 20 to 30% of waste from incineration. Reducing weight, as we mentioned before, from the dialyzer, you can purge all the fluid, air clear before discarding. It lowers the transport as well as the incineration energy. When you look at toxic reduction, we already spoke about phase out, that is reuse chemicals. If it is there, you can protect the local water systems and stuff. Resource efficiency, you can match the dialyzer size to the patient surface area properly, reduces the raw material consumption. And when you talk about single versus reuse, single use avoids the use of chemicals like formaldehyde, paracetic acid, glutaraldehyde, toxic chemicals which are used in reprocessing. It also saves a massive amount of ultra pure water, needing to rinse dialyzer 15 to 20 times. So in our setup, we are always using reuse of the dialyzer. But in long run, when you look at the patient for the next 5-10 years, the usage in long-term usage, reuse is less carbon intense compared to single use, because in single use you are going on adding on dialyzer each time. So they found that when you look at a long-term patient who has been there dialyzing for 5 years and plus, reuse has definitely been showing less carbon intense compared to the person using single-use dialysis. When you talk about transplant as green therapy, you can lower long-term carbon footprint by getting the patient transplanted is a single point of carbon emission during the surgery. Better outcomes, patient promote living donation should be propagated, and awareness should be given about disease donor transplant. There are a lot of initiatives which have been started by ISN, KDGO, and green nephrology programs all over. They're basically highlighting that focus on prevention, that is albuminuria, reducing blood pressure, cholesterol, diabetes, and estimated glomerular filtration as a rate of key warning signs. So the golden rule of green nephrology would be the greenest the dialysis is the one which never happens. So what it means is that you have to try prevent a person reaching to dialysis. So if this knowledge is very important for all of us, all our relatives, friends, and people who are there with us. You have to consider this as a basic that you identify patients in your family who are having diabetes, hypertension, whether they have got albuminuria, whether their BP is well controlled, sugar is well controlled, and make sure that they don't go into dialysis. That would be the greenest dialysis. But focusing mainly on the all these important steps like DM control, antiproteinate treatment, and trying to avoid as far as possible dialysis. But what can you do after listening to this lecture of green dialysis unit? What can you do tomorrow and start something for this? You can start auditing the water used in your unit. Very simple. You can consider proper waste disposable. I think this will be the best role for the first green champion in your dialysis unit to check whether the waste is properly disposed. You can purge lines thoroughly. You can do incremental dialysis. Find out whether the patient is requiring 3 per week or not, or patients who are requiring 2 per week, you're starting dialysis at 2 per week and then incrementing to 3 per week. You can check out their KT by V and URR and find out whether they are adequately dialyzed. Reduce the unnecessary labs as far as possible. Reduce unnecessary medications. Try to get teleconsultation in place so that some patients can avoid coming to the hospital. Whoever is very healthy, very consider no complications, stable patients which are there. Educate the patient and staff about the necessity to conserve the planet by doing certain steps which we discussed. And definitely tomorrow, everybody should identify a green champion in your dialysis unit and give a task and continue to see that your role is being played and maintain a register based on that, which will help you in the further audits and NABH interventions. So my take-home messages would be to save kidneys alongside, you should save our planet. Sustainable nephrology is the better medicine because the patients have to be dialyzed, patients have to be given care. But if we can do it effectively like this, we can run the planet for a longer duration of time. Start small, start today. Prevention is better. Green dialysis and transplant should be the future. Recycle and reuse so that as much as waste can be utilized and the waste dialysis spent water can be reused in planting, in using for your clean flooring cleans and things like that. Thank you very much. But before till you start the mission from tomorrow, planting 2 to 3 trees a year by us will compensate for carbon emission generated by one hemodialysis patient. So it is very easy for us to consider planting more trees and saving the environment. Thank you.